It is genetic disease. So this glue-like mucus builds up and causes problems in many of the body organs, especially the lungs and also the pancreas. So previously, usually CF ni kita jumpa dekat pediatric patient. But the numbers of people surviving to or being diagnosed at 18 years old is approximately about 42%. So this is the cystic fibrosis pathophysiology. So you can see here the cystic fibrosis. This is a normal airways. In this is the airway affected by cystic fibrosis. You can see that the difference here. Ada kalau kat sini punya airway wall dia macam ni, kat sini dia ada dilated airways. So kat sini ada a thin, kalau normal they have a thin layer of mucus coats the airway wall. It is a thin layer, tapi kalau dekat sini dia ada a thick and sticky mucus that blocks the airways. Then ada blood in the mucus, bacterial infections. So this is what we katakan laluan udara lah yang affected dengan CF ni. Okay. So dalam case CF, almost all exocrine glands are affected and secrete abnormally thick mucus that obstruct glands and also ducts in various organs. So due to CF, the pulmonary complications include acute and chronic bronchitis, bronchiectasis, pneumonia, parenchymal scarring, etc., that involve lung. Okay, so there is eventual obstruction of glands and also ducts, that can involve that can lead to chronic respiratory symptoms. So due to CF, perhaps there will be a malabsorption, and then CF-related diabetes, cirrhosis, dehydration, and also electrolyte imbalances. Okay. So what is the medical diagnosis for cystic fibrosis? So cystic fibrosis is a multi-system disease, and its management, it requires a multidisciplinary approach, including both GI, gastrointestinal, and also respiratory management. Okay, so macam sinus infection, glucose control, nutritional status, psychosocial issue pun kena assess and also manage in cystic fibrosis. That is why we learn about CF in the MND. Okay, so kalau nak diagnose in medically, doktor lah yang akan diagnose either by sweat chloride test, blood test, sputum cultures, pancreatic function test using DNA, etc., lah, untuk diagnose medical for the medical diagnosis. And once diagnosed, because it can lead to malnutrition as well, so that's why kita kena assess dia punya nutritional status. Okay, so apa implication dia bila orang yang ada cystic fibrosis ni, they might have poor weight gain and also growth. Okay, and poor digestion, absorption, and malnutrition. This can be due to the pancreatic insufficiency. Remember, CF ni dia involve exocrine glands. Okay, and then sebab ada poor weight gain, poor growth, poor digestion and malnutrition, they might have abnormal growth as well, and also risk for osteopenia and also osteoporosis. So our nutrition therapy, we should begin with the evaluation of the nutritional status. So tadi kita tahu CF patients selalunya akan ada growth failure. Penyebab dia multifactorial. It can be due to the malabsorption, it can be due to the increased energy needs, reduced appetite. So the assessment, the nutritional assessment, we should make it frequently. Secara interval lah, every 3 months, for us to prevent ataupun kita early detection of any nutritional status deterioration. So the nutrition assessment yang kita boleh buat is common macam patient lain juga ya. We perform their anthropometric measurement. Ya, sebab kita tahu CF ni selalu dikaitkan dengan growth failure. So we assess the anthropometric. Kalau infant kita tengok dia punya line ada pertambahan tak. Ya, and then kita tengok dia punya berat lah. Is it macam mana compare dengan dia punya graph ya. Is it okay or not. Ya. And then biochemical data and medical test if available. Okay. And the nutrition diagnosis, because of the complexity, multiple diagnosis may occur. Okay. So this table show the assessment of nutritional status for individual with cystic fibrosis. Berapa kerap kita nak buat lah. Ya. So that is sebutkan that is we should do it intervally. Ya. So macam we suggest for weight, height and also hip circumference, we assess them every 3 months. Yeah? And then other mid-arm circumference, tricep skin fold, mid-arm, we assess it annually. Okay? And then for FNRH, kita boleh assess it frequently lah. Kita boleh buat it annually or we can also do it every 3 months. It depends on the situation lah. Kita nak assess kan macam mana tengok ada changes ke tak kan. Yeah? At least once a year kita kena check lah dia punya FNRH. Yeah? Okay, as indicated lah bila nak tengok. Yeah? So, ada biochemical data as available lah. Depends on the availability. Okay. So, dekat dekat ISPEN ada published guidelines on nutrition care for infants, children and adults with cystic fibrosis. So nanti you all boleh cari paper ni. This is paper on 2016. Baru juga. So you boleh download, baca and summarize this article. Sekejap ya, I know this. Okay, let us continue. Yeah. So this is ISPEN guideline. Okay, please download and read the article. Okay. So the nutrition intervention for cystic fibrosis. Okay. So the nutrition related medication management include pancreatic enzyme therapy. Yeah. So kalau doktor kata perlu untuk bagi kalau is related to enzyme untuk pancreas kan, so dia kata perlu bagi pancreatic enzyme therapy, so dia akan bagilah. Yeah. So the pancreatic insufficiency is common, results in malabsorption of dietary fat, protein, fat soluble vitamins and also other nutrients. So just remember, recall balik lecture on ada belajar biochem kan, ada belajar sebelum ni pasal anatomy kan, what happen bila kita ada pancreatic insufficiency. So bila ada pancreatic insufficiency dia akan involve in akan results in malabsorption. Okay, so doktor akan sometimes they will prescribe the pancreatic enzyme therapy. Okay, so untuk cystic fibrosis, our MNT goal is actually we want to promote the optimal growth and also weight maintenance. That is our goal. Kita nak bagi optimal growth. Other than that, of course lah, kita nak increase muscle strength. Because you know that cystic fibrosis is related to osteoporosis, osteopenia as well. So you want to increase the muscle strength. And then you want to enhance the quality of life. So by enhancing the quality of life, the principle to achieve these goals are to correct the maldigestion and also malabsorption and to provide nutrients that are deficient. Okay. So energy and macronutrients, we should provide adequate calorie for normal growth based on weight gain pattern. And we suggest on higher fat intake. Fat intake is about 35 to 45%. So in order for you to achieve this higher fat intake, we know that orangnya sometimes ada low appetite kan so we can add in MCT oil for example to enhance the absorption of fat. So undernutrition in this kind of patient, it results from a mismatch between energy needs and also actual food intake. And this is actually complicated by malabsorption. Okay, so to date, high calorie diet, high fat diet, together with pancreatic enzyme replacement therapy, and also vitamin supplementation of fat soluble, it has been considered as the standard of nutritional care for cystic fibrosis patient. And then ada juga study yang recommend untuk ambil protein, increase intake of protein. And this is to maintain the lean body mass and also improve the long-term outcomes. Okay. Ada juga study yang suggest kita increase intake of essential fatty acid. Contohnya macam linoleic acid. So which is important lah, which is suggested for to improve survival and also growth. So this is the nutrition intervention. Basically, kita promote high energy, adequate energy, and then high fat, and also we suggest on increase their protein intake. Okay, supplements and infant feeding. Okay, vitamin and mineral supplements may be needed. So individualized supplementation of fat-soluble vitamin, supplementation to support bones is also important, and high salt diet is recommended especially in hot climates. So tempat yang selalu berpeluh kan, so dia kan akan lembes mucus selalu kan, akan terus selalu dikeluarkan kan mucus, so it's like to replenish. So we recommend high salt diet, tapi kalau kat temperature Malaysia ni tak ada lah. And then recommended infant feeding. So breast milk is recommended for first year of life and fortification of breast milk, if necessary. Okay. So let us look at the nutrition management of cystic fibrosis related diabetes. So the energy needs untuk orang yang ada CF ni it vary from individual to individual. Even in the same individual throughout the course of life, based on their gender, their age, their basal metabolic rate, their physical activity, respiratory infection, severity of lung disease, and severity of malabsorption. So the calorie intake is about 1.2 to 1.5 times of BRI for age, and is individualized based on weight gain and also growth. This is the calorie. Basically, it's higher compared to healthy people. Okay. And then for carbohydrate, it is individualized. Yes, so carbohydrate should be monitored to achieve glycemic control. Artificial sweetener should be used sparingly due to lower calorie content. Because cystic fibrosis ni kita cakap pasal orang cystic fibrosis related diabetes. Okay. And then for fat, no restriction on type of fat. High fat intake is necessary for weight maintenance, and you can aim up to 40% of fat from the total calorie. Protein intake is higher, approximately 1.5 to 2 times of the requirement. The sodium is liberal. We can give them high salt diet, and routine supplementation, if needed. So doktor akan recommend lah if the patient need additional supplement. And then alcohol, if the patient want to consume alcohol, need to consult with the physician. So kalau orang yang ada gestational diabetes mellitus, no calorie or carbohydrate restriction, adequate calories for weight gain. In those with pre-diabetes, no weight loss. Spread the carbohydrate throughout the day and consume nutrient-dense beverages. So basically, if you look here, the recommendation for the macronutrient, dia sama juga macam other people yang with diabetes lah, with diabetes patient general. Okay. Cuma kalori untuk yang ada CF ni, we recommend it higher than normal population. Okay. So this is a daily vitamin supplementation for cystic fibrosis patient. So kalau mineral intake, it should meet the gender and also age recommendation, according to the recommendation. So special attention must be given to some of the mineral. Contohnya macam kalau sodium requirement, contohnya I cakap sodium requirement dia may increase in cystic fibrosis because of the increased losses in sweat. Kalau bila ada imbalance in the electrolyte, contohnya bila sodium intake tu tak cukup, mungkin akan menyebabkan dehydration. It can lead to lethargy, vomiting. Okay. Supplemental salt condition, supplemental salt, it may be required under some conditions. Okay. So here is the developmental approach to nutrition counseling for individual with cystic fibrosis. So for infant, we recommend breastfeeding. We can add human milk fortifier to increase the nutrient density of breast milk. This is if needed. We can use iron fortified infant formula. And then solid food should be added according to the age. And infant cereal should be prepared with breast milk or infant formula. Pancreatic enzyme should be given prior to each feeding. And vitamin supplements should be given. This is for infant. Basically, it's actually a general rule of thumb. Breastfeeding, fortified, vitamin if needed. And then solid food when weaning, bila nak add when weaning. So for toddler or preschool age, whole milk should be encouraged for the children with cystic fibrosis. Adding calories to table food, and we avoid giving low fat or low calorie food. We encourage on regular meal times and snacks. Dietitian should inquire about feeding behaviors to promote positive interaction and prevent negative behaviors, and continue the pancreatic enzyme therapy. When the children reach school age, is between 5 to 10 years, dia dah masuk sekolah rendah, we encourage on normal and also healthy diet. And this may be a high risk period for decreased growth rate in children with CF. So we should identify factors that may interfere with meeting nutritional needs. And still continue on the pancreatic enzyme. So when adolescents, it is associated with high nutrient requirement due to accelerated growth, pubertal development and high level of physical activity. Okay. So patient yang ada cystic fibrosis, they shouldn't be encouraged to decrease their activity level. Tapi kita minta dia increase energy intake. Okay. So nutritional counseling will be more effective if directed toward the adolescent, not the parent. Adolescents may be more receptive to efforts to improve muscular strength and body image rather than stressing weight gain and improve disease status. And still we continue the pancreatic enzymes and vitamin. So because of the numerous intricate manifestation and complication, nutritional requirement and care must be individually determined for each patient. MNT must be coordinated with other treatments, including a variety of different kinds of medicines and just physical therapy. So this is the goal of nutrition care in cystic fibrosis patient. And we want to control the malabsorption. We want to provide adequate nutrients. This is to promote the optimal growth or maintain weight for children. Okay. So for children and adults, intake can be enhanced by regular and enjoyable mealtime, larger food portions at meals, extra snacks, and food selected for high nutrient density. Homemade or proprietary nutritional supplements such as fortified beverages and puddings also can help the individual with CF to attain their nutritional goal. Intensive supplementation has been associated with improved weight gain, slower decline in pulmonary function, decreased incidence of respiratory infection, and improved sense of well-being. So eating may become unpleasant activity because of severe pain, dyspnea, and dyspepsia. Weight loss, along with associated declines in other anthropometric and laboratory indicators of cancer-related malnutrition, presence of worsening prognosis. Thus, providing foods, beverages, and nutritional supplements in the forms and at the times best tolerated by the patient is essential. Okay? Administering oral medication with calorie-dense nutrition supplement is another means of supplying needed nutrients. Okay? That is about cystic fibrosis. Yeah? It is a genetic condition. Yeah, so kalau you jadi dietitian yang assigned to genetic ward, ya, contohnya macam you dapat, kalau you are lucky enough to be hired in HKL contohnya, diorang ada genetic clinic, ya. So you might see this kind of patient. Yeah? So you will follow them from baby lah, daripada infant lagi you akan follow lah, and you will be really good at managing this kind of disease. Okay? Now let us look at pneumonia. Pneumonia ni biasa kita dengar. Ya? Kalau orang yang masuk hospital kan, seperti dulu masa time COVID kan, kita dengar pneumonia kan, ataupun baby ke ya, pneumonia. So what is actually pneumonia? It is actually inflammation of the lungs that is caused by bacteria. It can be caused by viruses or fungi, or as a consequence of aspiration of food, fluid, or secretion such as saliva. Ya, sama ada inflammation ataupun sebab ada aspiration lah. Ya, aspiration. Ya, aspiration is simple as tersedak kan. Ya, makan minum air ke kan, untuk orang tua, orang yang baring ke kan, tak boleh makan, yang ada dysphagia ke kan, ya, tersedak, ya, can lead to inflammation of the lungs. So aspiration is common in infants, in children, adults who are frail, have frequent coughing spasm, are unable to effectively chew or swallow their foods and beverages, or have inadequate head and neck control during eating. So the infection of foreign material cause the alveoli to become inflamed. So these air sacs filled with fluids or pus, which result in symptoms including cough, fever, chills, and labored breathing. So the etiology of pneumonia, there are three general types. First is community acquired. Dapat daripada community. Contohnya pneumonia related dengan COVID kan, dapat daripada community ke mana-mana lah. Ya? Dapat kat taska ke, kat sekolah ke, kat tempat kerja ke, kat pasar malam ke contohnya, ya. Community acquired, CAP. Hospital acquired pneumonia, HAP. Ya? Kisahnya warden disebabkan lain. And then berjangkit dapat pneumonia pula daripada hospital, ya. Daripada orang ke hospital ramai pneumonia kan, banyak virus kan, banyak bakteria kan, ya. Berjangkit pula ke hospital, dapat ke hospital. So that's we call as hospital acquired pneumonia. It can be also acquired from the ventilator itself. Ya, prolonged ventilation for example, ataupun masa intubation tu, ya, inflame. Ya. So that is we call as ventilator acquired pneumonia. So once pneumonia occurs, the goal of nutrition care are to provide adequate fluids and also energy. Small feeding, frequent feeding, usually are better tolerated, coupled with proper positioning during eating. Okay. So this table show you the risk factors associated with aspiration. Okay. The risk factor include decreased level of consciousness, neuromuscular disease, intubation or mechanical ventilation, vomiting, delay gastric emptying, advanced age, poor oral care, high gastric residual volume. Kita makan banyak sangat pun kan, boleh tersedar juga kan, terkeluar balik macam jet tu. Prolonged supine position, presence of nasogastric tube, non-continuous or intermittent tube feeding, and large diameter of feeding tube or malposition of feeding tube. This is among the risk factors. So that is pneumonia. Apa tadi pneumonia? It is inflammation of the lung. This is commonly seen. Okay. Now we look at the respiratory failure. What is the respiratory failure? It is when the pulmonary system is unable to perform its function. This may be caused by traumatic, surgical, or medical. So multiple organ dysfunction syndrome is the term used to denote abnormal interaction among the organ systems, culminating in relentless dysfunction of all organ systems. Acute respiratory distress syndrome is common complication of critical illness. Ultimately, in respiratory failure from any cause, the patient requires oxygen provided through a nasal cannula or by mechanical ventilator support for varying lengths of time and at various levels of oxygen. So this table shows the conditions associated with the development of acute lung injury or respiratory distress symptom. So this is the cause of direct injury, contohnya pneumonia, aspiration of gastric contents, inhalation injury, etc. And this is the inflammatory ataupun indirect injury, contohnya daripada sepsis ataupun daripada severe trauma, acute pancreatitis, cardiopulmonary bypass, massive transfusion or drug overdose. This is indirect lah. Kalau direct ni, kalau you tengok memang directly to respiratory system. So kalau respiratory failure tadi tu, maksudnya memang dah unable to perform the function. So that's what we call as respiratory failure. Okay. So apa kita nak buat bila dah respiratory tak boleh function? So the nutritional implication, nutrition support determines by underlying illness and also GI function. We check what about the GI function. So the route determined by Aspen guideline. Okay. So the assessment is very widely depending on the age, prior nutritional status, and also underlying disease process. So the calorie requirement can be either estimated using a predictive equation or directly measured using indirect calorimetry. Tapi kita akan biasa guna equation lah, equation. So provision of immunonutrition may reduce systemic inflammatory response. So kalau dia dah memang on tube feeding, sebab dah respiratory failure, so ada produk yang memang ada immunonutrition. So the nutrition support guideline for respiratory failure, so we perform nutrition assessment which include evaluation of weight loss, previous intake, disease severity, comorbidities, and also GI function. We should use indirect calorimetry to evaluate the energy requirements whenever possible. We provide supplemental protein and consider use of permissive underfeeding in obese patient. Okay. So apa nutrition intervention? So usually untuk orang yang ada respiratory failure, is using enteral nutrition support. When the GI tract is still functional. So we prefer early enteral nutrition. We attempt to reach 65% of goal within the first week of feeding. Polymeric formula. with immunonutrient is preferred if the GI tract is functional, and we can use parenteral nutrition alongside the enteral nutrition to meet energy requirement if target volume of EN cannot be tolerated. Yeah? So kalau you perasan, masa kita discuss pasal respiratory failure and when we discuss about pneumonia baru ni, I tak ada bagi berapa energy intake nak ambil. Tak ada. Because usually it is based on your assessment. Sebab kalau macam case respiratory failure ni, tengoklah kalau patient tu dah ada nutrition support, ada enteral nutrition. Tengok situation dia waktu tu. Dia daripada apa? Dari parenteral feeding. Lepas tu berapa full feeding nak tengok macam ni. Tengok dia punya condition lain. Macam mana dia punya berat badan. Adakah dia overweight? Adakah dia underweight? Apa underlying disease dia? Kat situ kita determine dia punya energy requirement. Because usually it's dia punya disease ni akan jadi kompleks lah, those yang ada case macam ni. Pneumonia selalunya acquired from other disease as well. So kita determine dia punya berapa body weight dia semua daripada conditions dia waktu tu. Dia tak boleh cakap semua respiratory failure higher energy intake than needed. No. Kot yang dapat respiratory failure tu memang orang yang tengah obese. Adakah kita nak buat untuk weight maintenance ke macam mana? So we depends on the condition during that time. Berapa requirement yang diperlukan? What is the inflammation? Ada any injury ke that require high protein? Adakah dia diabetes that need to monitor dia punya sugar? How about dia punya cardio? Kita tengok benda-benda lain jugalah. Okay. But protein is usually higher because of the inflammation status. Okay. Now let's look a little bit on the transplantation. Yes, because kita cerita pasal respiratory kan. So replacement of lungs is also quite common lah. Untuk lung transplantation. So for lung transplantation is require immunosuppressive agents. And nutritional side effects include GI distress, increase in blood pressure, edema, and also alteration in blood sugar. Later masa belajar transplantation kita akan tengok lagi details lah pasal ni. Okay. So the nutritional implications for person undergoing transplant, it can be underweight, overweight or normal weight sebenarnya. Tengok sebabnya sebab apa? Lepas transplant ni tengoklah dia punya QOL macam mana, adakah dia motivate to regular monitor dia punya health status kan, and then buat the corticosteroid pun also sometimes can increase the weight. So for the nutrition assessment, we assess their body composition, weight, and also their nutrient requirements. So bila tengok cerita pasal transplant, kita akan tengok dia punya pre-transplantation requirement-nya during transplant and post-transplant is also slightly different. Okay? So the protein and energy requirement affected by the stress of surgery, post-operative complications, episodes of rejection, and also use of immunosuppressant drugs. So the nutrient intervention for transplant, we want to optimize nutrition status pre-transplant. So before transplant tu kita nak mention dalam keadaan yang sihat lah kalau boleh, tak ada malnutrition, berat badan okey kan, tak obese, tak kurus sangat, And acute post-transplant, we want to promote wound healing. When we say that we want to promote wound healing, we encourage on higher protein intake. We treat the electrolyte imbalance, look at the imbalances. And what should we treat? And also achieve optimal blood glucose control. Okay, so that is for transplant. Nanti kita ada topik khas untuk transplant lah. Okay. Kita touch sikit on upper respiratory infection. This is very common. Orang jumpa, tak nak makan apa, saya sesama, apa yang boleh makan, apa yang tak boleh makan. Rasa susah nak jawab because it's very basic. So upper respiratory infection is the common cold, acute infection. So clinical manifestationnya running nose, coughing, sneezing, sore throat, headache, macam saya selalu sangat sesama kan, saya sendiri pun tak tahu dah nak makan apa lah kalau tengah pasal makan. Not everything is about food. Okay. So apa nutrition implication dia? large doses of vitamin C do not affect cold incidence. Do not affect. Ya. Tak ada pun tadi cakap bila you kena sesama, you makan mega dose of vitamin C, then you can improve your flu. No. There is no such evidences. Kalau nak makan vitamin C, kalau if you really want to make vitamin C is your routine, provided that you don't have sufficient fruits and vegetables intake per day. Contoh macam I lah, I still honestly say that I don't really take fruits and vegetables on daily basis. Sebab kadang kalau ke office tak sempat makan tengah hari kan, so tak cukup kan. So we can consume the vitamin C. Tapi kalau nak cakap vitamin C tu boleh improve cold incidence tu, tidaklah. Jangan pula masa sesama pergi makan 2,000, 5,000 miligram vitamin C. No, you will just burden your kidney. Tak, This is an expensive urine nanti kan. So tiada evidence macam tu. But you can take vitamin C as you punya routine lah, daily routine with dengan amount yang bersesuaian lah. So jangan ambil mega dose semua because there is no such evidence. Okay. So kalau sesama nak makan apa ni? Sini we just suggest on minum air secukupnya and just take healthy food, and then it's just infection. Okay. And others such as TB, lung cancer, OHS, I tak ajar di sini. Macam contohnya macam TB ni bila infection bila batuk nanti cough droplets tu that contain the bacterial parasite. So the small particle, it can penetrate deep into the lungs and cause infection. So that is TB lah. So what is the management of TB? Again, it depends on the condition of the patient. Kalau dia malnutrition, kita treat malnutrition. Dia perlukan extra protein, we request for additional protein. Tengok dia ada diabetes ke sakit lain kan, so it depends. Kalau patient kata dia tak ada appetite, dia tak selera makan, very poor nutrient intake, maybe we can suggest on nourishing fluid, for example. So it depends on the condition. Kalau case lung cancer, we treat it same as other cancer juga, about the same as other cancer. They might require higher energy, higher protein. Ataupun kalau masa chemotherapy, what should we modify their food? Apa food yang kita nak suggest masa chemo so that they can have better appetite, they can tolerate well to the food. Apa nak makan masa dia fatigue, we can treat their sign and symptoms lah untuk cancer. Same goes to obesity, hypoventilation symptom. So we can suggest them on weight management lah. So this is all common cases, common disease that involve respiratory. Okay. Next is habis dah. So that's all about respiratory disease. So kita habis about 45 minutes juga kita cover pasal respiratory ni. So itu je lah pasal topik respiratory. Okay. Now we continue to burn pula. Sekejap saya buka. Burnnya. Okay, burn tak banyak slide kot. Dalam 28 slide je ni. Okay. Okay, kita tengok respiratory. Nanti you all akan buat case study. I provided 2 case study about BPD and also COPD. Just go through and discuss dengan ahli group lah, and please do it carefully lah walaupun kita tak tanya dah dalam test tapi it's very important for you lah to understand it. Okay, now we look at the burn, MNT for burn wound. This is the outline. We'll go through the pathophysio, medical management, and also MNT for burn. Okay. So burn is a tissue injury caused by exposure to heat, radiation, chemicals or electricity. Misalnya terbakar kena api ke kan, chemical kena acid ke, electric So this is all burn lah. Ya. Kalau thermal exposure tu macam kena air panas. Melecur air panas teruk kan. Minyak panas ke ya. I think selalulah, bukan selalulah, biasa jugalah jumpa kes kan terkena minyak panas. Mak masak dekat kedai kan, minyak panas tumpah kaki, and then sampai second degree of burn. So it's direct contact with heat source. Burns chemical tu chemical or electric tu, electrical current lah bila electrical current tu move through the tissue ataupun bone tu, so it's electric lah. So kalau chemical tu macam expose kepada acid, expose kepada macam cleaner punya acid tu kan, battery acid ke, environmental sources ke, so that is chemical burns. So the result from the injury pasal burn ni, it can it is to the skin and it may extend into muscle and also bone. And the depth of the wound and the percentage of body surface area that is affected are used to classify the burn injury. Tengok kat sini, ni gambar yang penting tu you all tengok. The interpretation of burn classification based on damage to the integument. So ada kat sini, kalau tengok dekat sini, dekat atas ni lapisan kulit kita lapisan kulit kita. Dekat atas ni, dekat epidermis sahaja, so kita kata dia adalah first degree burns. So kat sini adalah burn that affect only the superficial skin layer, apa kita panggil first degree burn. So kalau dia first degree burn, keadaannya dia macam merah lah, red dia, without blister and pain. Typically dalam 3 hari dah okey lah. Contohnya macam melecur kan, masak-masak terkena minyak panas sikit kan so dia merah lah, dia merah, tak ada blister, ataupun maybe ada sikit blister kan, tak payah jumpa doktor, tak payah masuk hospital. 3 hari hilang. So that is first lah. Okay, first degree burn. Sikit lah tapi still lah kena pedih lah kan masa 3 hari tu kan. Tapi kalau injury tu extend into some part of the underlying skin layer, dia masuk ada partial thickness. Kau tengok gambar ni kat sini. Kat sini. It's into the dermis lah. So selalunya kalau dekat second degree ni ada blister lah. Memang dah, kalau dah masuk secondary, it's very painful. Memang akan berparut. Healing pun lama lah, maybe dalam 2 minggu. Baru kita sembuh lah. So dia dah masuk sampai ke lapisan sini. So dah masuk underlying skin layer. Okay. So ini kita panggil second degree burn ataupun partial thickness. Partial thickness. Okay. So dekat sini bila dah masuk third degree burn, it's actually under the subcutaneous tissue. This is a full thickness or third degree burn. Where the injury extends to all layer of the skin. So often there is no pain and the burn area is stiff. And so kalau dah masuk dekat third degree burn, healing tu dah tak boleh nak baik sendiri. So dah masuk kat third degree, dekat kena kat sini, kat subcutaneous tissue. And then kalau dah masuk sampai 4th degree burn, kat sini dia dah involve injury to deeper tissue. Contohnya dah masuk ke muscle, dah masuk ke tulang, ke bone. So kalau dah masuk dekat kategori ni, selalunya keadaan burn tu dah jadi hitam lah. Dan selalunya memang kena buang that burn part. So this is the category of burn. 1, 2, 3, 4. Okay. So how to determine the total body surface area? Ni adalah rule of 9 untuk adults. So rule of 9 ni adalah cara untuk make a rapid estimation of body surface area that has been burned. Kenapa bila nak guna benda ni biasanya kita guna for the basis for prescribing fluid and medic. Tengok berapa surface area dia. So tengok kat sini dia punya skin area, adult skin area, head and neck is 9%, torso about 36%, bahagian arm sahaja 18%, maksudnya each depan ni 4.5, belakang 4.5, 4.5, 4.5. Legs total is 36%, depan 9%, belakang 9%, and also perineum is about 1%. So total lah kan, contoh dia terbakar dekat tangan, bahagian sebelah tangan ni sini 9%, kat bahagian sini 9%, so dah 18% body surface area contohnya. So kita kata kalau major burn injury is those affecting more than 20% of total body surface area. So itu dah kira major burn injury. So they may be assessed for nutrition support. So burn patient ni, they may meet their requirements orally. However, it often depends on the depth and severity of the burn. This is the rule of 9 for adults. Okay. This is a rule of 9 for infants. There is slight difference compared to adults tadi. Sini head and neck is 21%, each arm is 10%. Nanti you tengok kat sini lah berapa. Abdomen 13%, each leg is 13.5%. So tadi kita kata kalau major burn is more than 20%. So kalau tapi kalau compare dengan children dengan adult ni is difference lah. Kalau partial burn, partial or full thickness burn in adult is more than 10%, tapi kalau in children is more than 5%. Okay, now let us look at the major burn. So major burn is a severe trauma. Because skin, as the protective organ, they can no longer prevent infectious agent from invading the body. So fluid and electrolytes are most essential. And wound management, it depends on the depth and extent of injury. So we check the stage. Dia dekat stage mana. So weight loss is common in people with burn. So age, nutritional status, and other comorbidities will have an impact on the physiological response to the injury, treatment, and also recovery. So banyak energy nak bagi. So the energy expenditure, it can increase as much as 100% above the resting energy REE, depending on the extent of the injury. So wound healing can occur only in the anabolic stage and success of early enteral feeding. So patient yang ada burns ni, untuk yang ada major burns ni, dia akan kehilangan protein lah, protein through the burn wound. So you must replenish the protein. So burn patient also very susceptible to infection. So that's why we should increase their energy and protein requirement. Okay. So the pathophysiology, the physiological response to burn injury progress through the same phases of metabolic stress. The hypermetabolism, catabolism, autoimmune, and also hormonal response. Okay. So dia yang sebutkan burns ni dia adalah satu trauma lah. So apa, badan kita akan respons to ada metabolic response to stress lah. Okay. So at temperature greater than 44 degrees Celsius, proteins begin losing their three-dimensional shape and start breaking down. So this will result in cell and also tissue damage. And many of the direct health effects of burn are secondary to disruption in the normal functioning of the skin. So this include disruption of the skin sensation, ability to prevent water loss through evaporation, and also ability to control body temperature. Yeah? So bila ada large burn, there will be a significant inflammatory response. So there will be increased leakage of fluid from the capillaries, subsequent tissue edema, so ada plasma loss, poor blood flow to organs, mungkin juga kalau boleh menyebabkan renal failure and also stomach ulcer, and then changes in the hormone, that will affect the metabolism. So the metabolic response to stress, to summarize, is actually involve most metabolic pathway. An accelerated metabolism of lean body mass, negative nitrogen balance, and also muscle wasting. It is not the strongest of the species that survive, nor the most intelligent that survive. It is the one that is most adaptable to change. So metabolic response to stress is the part of the adaptive response to survive critical illness. So lepas ni kita akan tengok apa metabolic response to trauma. Kita panggil dalam ada 3 fasa. Ebb phase, flow phase, and the bleed phase. And then we relate back to the burn. Okay. What is ebb phase? So the ebb phase, it develops the first is ebb phase. Ebb phase. It is immediate hypovolemia and also shock tissue hypoxia. During ebb phase, it is characterized by reconstruction of body normal tissue perfusion and efforts to protect homeostasis. Our body wants to protect the homeostasis. So in this phase, there is a decrease in cardiac output, decrease in oxygen consumption, lower body temperature, and insulin level decrease because glucagon is elevated. So generally, there are hemodynamic disturbances due to decrease in effective circulating volume within the first few hours after injury. This is actually to conserve both circulating volume and energy store for recovery and repair. Ini first hours dalam masa 2 hari lepas injury. So in burn injury, it also includes rapid fluid shift and accumulation, and therefore excessive fluid loss from the wound. So kenapa kat sini? Ini yang terjadi masa ebb phase. So the initial treatment after burn injury is fluid resuscitation and stabilization of organ system. Okay. After ebb phase, it is followed by flow phase. So it follow fluid resuscitation and restoration of oxygen transport. Tengok kat sini apa jadi, ini terbalik dengan ebb phase tadi. So it increase cardiac output, increase body temperature, increase energy expenditure, and total body protein catabolism begins. So basically, the flow phase we can define as an all or nothing reaction. Maksudnya kat sini the substrate flow, it should be high enough for the for the hit and run reaction. So masa fasa flow ni lepas dah tadi tu sampai 48 jam lebih kurang sampai 2 hari 3 hari so dalam masa 2 hari ke 7 hari pula badan kita akan enter the flow phase. So maksud ni masa tadi our body try to prevent situations like bleeding and also infection. Although this response is necessary for survival in the short term, if it persists over a long period of time or if the response is severe, then it can lead to the onset of body damage. So during flow phase ni, dia akan ada hypermetabolism, altered in skeletal muscle protein, alterations in liver protein, and also insulin resistant. That is during flow phase. Okay. Sekarang apa kaitannya dengan burn tadi? Sebenarnya lah bila orang jadi burn ni kalau dah major burn, dia ambil masa untuk baik kan, dia sampai up to 8 week, 1 month, 2 month, 3 months, so pada awalnya dia akan melalui this ebb phase and then masuk ke flow phase. Although dia akan, biasanya kita akan refer kat dietitian masa dah phase dah seminggu dulu baru ni kan, tapi this is what happened initially. Orang yang ada trauma ni akan tengok masa awal reading bacaannya nampak banyak abnormal lah, because the body try to adapt to the situation. Dia nak maintain, dia nak preserve badan dia. So the medical management of burns, it's actually extends beyond the scope of dietitian lah. However, successful care requires dietitian in the burn management. So the medical management include the fluid and electrolyte repletion, wound management, and also ancillary measures. So complication of burn injury, it will involve all body systems. Thus, management require extensive intervention and care for the respiratory, cardiovascular, and renal system affected by the burn injury. Okay. So kita dah rasanya ancillary measures ni macam involve the physiotherapy, kita panggil OT kan, pakai heat blanket, some may need psychologist, so this is ancillary measures. About the fluid and electrolyte repletion, the first 24 to 48 hours of treatments, is the fluid resuscitation. So volume of fluid needed is based on the age and weight of the patient and the percentage of total body surface area of burn. Okay. This is some of the common nutrition diagnosis, common nutrition problem lah, nutrition problem in burn, increased energy expenditure, increased nutrient needs, impaired nutrient utilization, alter GI function, and also alter nutrition related laboratory videos. What is the nutritional care goals for burn patient? We want to minimize the metabolic response by controlling environmental temperature, maintaining fluid and electrolyte balance, controlling pain and anxiety, and also covering wounds early. And meet nutritional needs by providing adequate calorie to prevent weight loss of more than 10% of usual body weight. Early enteral nutrition, providing adequate protein for positive nitrogen balance and maintenance or repletion of circulating protein. And then providing vitamin and mineral supplementation as indicated. The matter is ancillary measures. So this is how to meet the nutritional needs. Okay. Macam mana nak calculate energy untuk burn? Okay, so dia ada banyak formula yang boleh guna dah belajar macam-macam formula kan? So one of the specific formula for burn is using Toronto formula. Toronto formula dia tengok resting energy expenditure sama dengan ni formula dah. Dia ada 10.5 kali total body surface area burn. Ni tengok kat doktor lah, doktor akan tulis berapa persen of body surface area. Kalau ada maklumat ni, then you can calculate using Toronto formula. Plus tambah ni, calorie, 0.84 Harris Benedict, you still have to use Harris Benedict formula kat sini. Yang ni Celsius temperature dia. Sorry. And then 4.5 times days post burn. So kau nampak kat sini, this is specific for burn lah, provided that you have all the information kat sini. So there's a numbers of formula that could be used to provide range of estimated requirement, And we should reassess the energy requirement on a regular basis. Okay? So when calculating the requirement, it is important for us to consider the use of ideal ataupun usual body weight. Nak guna mana satu? Kalau orang tu obese, guna ideal body weight ke nak guna usual body weight? Yeah. So you should be familiar with that lah. I know that you already learn that. Yeah. Bila nak guna usual, bila nak guna ideal, bila nak guna normal body weight. Yeah. And then we should reassess the wounds. Dah heal ke belum? Kan? Tentunya kita akan provide with high protein diet. Bila tengah wound healing tu. And then we reassess lah, tengok kalau luka dah baik kan, do we still need to provide them with higher protein intake? And then we ensure at least twice weekly revaluation. Tengok dia punya graph mesh. And we consider the impact and continuum of physiotherapy and occupational therapy using the activity factors. Okay. This is Toronto formula. Okay. If you have all the information, then you can calculate using Toronto formula. Okay. Then modified Harris-Benedict equation. Just ni, kalau male and the female, you can use this. Kalau ada information on the weight, height in cm and also age. And then estimated energy requirement is you have to times lah BE ni times dengan injury factor. So ini adalah injury factor that are commonly used in the hospital. Tapi the origin is unclear. Kalau ada modification ke, kalau ada yang latest, so depends on your practice lah. This is actually commonly used lah. Kalau bawah 10% kita guna 1.2. Injury burn 11 to 20% with this factor 1.3 and so on. Okay. We can use Toronto, Harris-Benedict. You can use Schofield equation. This is the equation. There's a difference between female and male. Kita hanya perlukan data on body weight only. Okay. However, using this Schofield, you need to calculate energy requirement. You need to calculate with injury factors and also activity factors. So this is the injury factors. Kalau up to 10% is up to 1.1. Up to 25% is up to 1.3 injury factor, and if the injury factor, the percentage of burn is more than 25%, it's up to 1.7. So the activity factor is including diet-induced thermogenesis, bedbound ke, mobile on wards ke, different lah dia punya activity factors. Okay. Other than that, we can also use Ireton-Jones equation. Okay. So we need data on age, their weight, and then also in the diagnosis of trauma, whether there's a present in trauma or not. So usually, kalau we need the present of burn, Ireton-Jones, we always use it in the intensive, in the ICU. Okay. Next, we have Carreri formula. Adult 25 kilocalorie per kg actual body weight plus 40 kilocalorie over the berapa persen dia punya TBSA burn. And this is for children. Tapi using this Carreri formula, it is well known to overestimate the requirement. Okay. This may be due to advance in the medical management of burns, which have reduced the hypermetabolism associated with burn injury. For example, we have now early excision and also grafting, wound dressing, and also environmental temperature control. So formula Carreri, it was developed for burn patient. However, I've indicated that this equation best estimate energy requirement as the peak of injury. at the peak of injury, bukan dah after few weeks or few months of injury. Because it is known to overestimate the requirement. We want to overestimate because overfeeding may cause morbidity such as fatty liver infiltration and also increase infectious morbidity. Okay. So I introduce you to few formulas in bird. So which one you want to use? So bila kita, you as a student, nak pergi clinical, nak buat case study, dapat case study burn for example. So you have to do nutrition assessment first. Dia tengok nutrition assessment, berapa currently diet intake dia, apa you punya nutrition diagnosis and what is your goal. Then you nak plan intervention. You can use several formulas. Kalau you as student, you can compare all 4 formulas. And then you tengok mana yang paling sesuai. Macam itu mana yang paling sesuai. Which one is most relevant compared to their current intake, compared to their appetite. And then later you can reassess. Because kita ada few formulas. And tak ada satu formula pun yang kita salah tak boleh guna. So you can use either one. In fact, dekat hospital sometimes kita nak cepat, kita guna quick method je semua. But we have to reassess lah. Mana satu yang paling sesuai dengan condition patient tu based on your nutrition assessment. Okay. So protein in major burns, protein losses occur from urine, wound healing process and also increase gluconeogenesis. So 20% to 25% calorie as protein needed. We suggest on high biological value, around 1.5 to 2 gram. So adequacy best evaluated by monitoring wound healing and also grafting. Accurate weights and nitrogen losses are difficult to obtain. So we suggest on high protein up to 2 gram per kilogram body weight. Tapi kita monitor lah dia punya wound healing. Kalau nampak dah cantik dah wound healing tu, so we can reduce the protein requirement. Okay. Energy and protein adequacy in major burns. So again, we monitor the wound healing. So this is the estimation of wound nitrogen losses when calculating nitrogen balance. Dia tambah nitrogen balance lah. So kita tengok lah dia punya non-protein calorie to nitrogen ratio. Apa macam mana kita nak calculate. Kalau less than 10% of upper wound is 0.02, 11% to 30% is 0.05, and more than 31% is 0.12. So kita compare lah dengan desirable NPC and weight ratios tu. Ada contoh hanya seras ni. Ada tak contoh? Tak ada Ada contoh pula maksudnya. Nanti tambah slide on the calculation of nitrogen balance. How to calculate nitrogen balance. I think you are not really clear bila I cakap macam ni nak tambah nitrogen balance. Okay, nanti I akan tambah slide lah on nitrogen balance, how to calculate. Okay. Let's look at the vitamins and minerals in major burn. So vitamin C for collagen synthesis and immune function. Vitamin A. So because of hyponatremia and hypokalemia, they may need additional supplementation. But we still need to monitor regularly lah. So kita tak bagi supplement. So all these supplement will be prescribed by the doctors. Okay. So methods of nutrition support in major burns. So kalau burns less than 20% of total body surface area, we provide on regular high calorie and also high protein diets. So patients with major burn with very high energy needs or poor appetites may require enteral feeding and occasionally parenteral nutrition. So the rule of thumb is we provide high calorie, high protein diet. How to achieve that high calorie diet kalau patient tak boleh makan? So we can provide supplementing nourishing fluid. Kalau tak boleh juga, you may suggest on enteral feeding ataupun parenteral feeding. This is the ISPEN endorsed recommendation, the nutritional therapy in major burn. This is also an important paper for you to read. Apa dia punya guideline. So the indication is nutritional therapy should be initiated early within 12 hours of injury. And the route, given priority to the enteral route, parenteral administration being rarely indicated. Energy requirement, we suggest on using calorimetry. Tapi kalau tak ada, kita recommend using Toronto equation for burn adults, provided you have all the information. For burn children, we suggest to use Schofield formula. So protein requirement are higher, should be set around 1.5 to 2 gram per kilogram in adults and 1.5 to 3 gram per kilogram per day in children. So kalau ke hospital kan, high protein diet dia akan bagi sebiji telur extra. Kids pun lebih kurang lah. Biasa diet ke hospital kalau high protein dia bagi telur je. Kalau hospital government kan, because it's cheap lah kan. Kalau dia boleh bawa daripada rumah, bolehlah suggest on increase the fish ke, chicken intake ke, to meet the protein requirement. Okay. Ya, boleh baca kat sini lah apa recommendation untuk burn dia sini. Okay. This table show the best predictive equations according to the burn literature. Okay. This is just summary lah daripada tadi best predictive like I say. So adults we recommend using Toronto, and kids we recommend using Schofield formula. Dah habis ke? Okay. So the focal points here, the combined impact of metabolic alteration that occur in stress and bed rest can lead to rapid and severe depletion of lean body mass. So nutrition support cannot fully prevent or reverse the metabolic alteration and disruption in body composition associated with critical illness. However, nutrition support likely ameliorates the rate of net protein catabolism. So clinical judgment is paramount in making decision about the need to initiate nutrition support. For patients who will require enteral nutrition, it should begin as soon as hemodynamic stability is achieved. Enteral nutrition is preferred because of its role in maintaining gut integrity and immunity. Critically ill patients who are injured, septic or bedridden cannot be expected to gain weight, lean body mass or strength until the hypermetabolism resolve and physical therapy, exercise and rehabilitation begin. Okay. So basically apa yang disampaikan di sini adalah burn ni adalah part of the hypermetabolism. They involve trauma, it's involve stress. So it's involve the ebb and also flow phase tadi tu. And nutrition support is very important. Okay, berapa banyak nak bagi? It's require high energy and also high protein intake. Berapa high protein intake tu, we need to reassess the wound. What is the best formula to use? We use Toronto for adults and we use Schofield for kids. But it still depends on the situation. So kalau orang yang tak boleh nak makan orally, we can suggest on enteral nutrition for those burn patient. Berapa lama burn patient duduk dekat ward? Lama. Pernah jumpa kes berbulan-bulan. Kenapa? Sebab contohnya kena panah petin. Berbulan-bulan dekat hospital. Sebab dia kena ada fizioterapi, nak belajar jalan balik kan. Lamalah duduk hospital tu. Okay, so that's all. That's all for our lecture. Habis dah pasal burn. Okay. So untuk burn, you all kena I think I tak ada case study for burn. I think I have, nanti kalau ada tutorial nanti I akan upload tutorial untuk burn. Okay. So itu saja topik burn. Do you have any questions so far? Any lah.
No.